The broadcast is now starting. All attendees are in listen-only mode.
Good morning and good afternoon. Thank you for joining us. We'll be starting the webinar in about 5 minutes. Good morning and good afternoon. Thank you for joining the webinar. We'll be getting started in just a couple of minutes. Thank you. Good morning and good afternoon. Thank you for joining us for today's webinar, Selecting and Implementing Evidence-Based Practices. My name is Mariana Corona, and I'm an associate with Children and Family Futures. Before we get started, I'd like to briefly walk through how to ask questions in the GoToMeeting interface. On the bottom half of your panel, you will see a question and answer log. Please enter your question there so that our presenters can try and address these during the webinar. I would also like to let you know that you will receive an email with a link to the recording and materials once that is posted to the Children and Family Futures website. Thank you. And now I'd like to introduce Mr. Ken DiSturcio. Ken?
Thank you, Mariana. Good afternoon, everyone. My name is Ken DeSarcio. I'm a program director with Children and Family Futures and the National Center on Substance Abuse and Child Welfare. And welcome to today's webinar, Selecting and Implementing Evidence-Based Practices, Challenges and Considerations. This is our 5th webinar in a series on implementing evidence-based practices. And while our previous webinars have addressed the implementation of specific evidence-based practices, today we're focusing on the selection and the challenges and considerations in selecting and implementing any evidence-based practice. And we're not going to be speaking about specific practices today. Now, many of you out there have already selected and are in the implementation phase of evidence-based practices. But also, many of you are experiencing challenges in the implementation of these EBPs. And part of today's presentation will be how your implementation challenges can also be linked back to the selection process. And we will cover both of those. Cambria will cover both of those today. In addition, there's no doubt evidence-based practices in your future work around in collaborative practice. And so we hope that this webinar will kind of meet both of those needs, if you will, both your current implementation challenges as well as equip you to strengthen your selection process as you consider additional evidence-based practices in your work moving forward. Today's program is brought to you by the National Center on Substance Abuse and Child Welfare, and the National Center is supported by the Substance Abuse and Mental Health Services Administration, the Center for Substance Abuse Treatment, and the Administration on Children, Youth, and Families, and the Children's Bureau, and the Office of Child Abuse and Neglect. The National Center has been in operation since 2002. We've enjoyed the support of both SAMHSA and the Children's Bureau as a technical assistance provider around collaborative practice among substance abuse, child welfare, and court systems. And I'd like to introduce to you our Federal Project Officer from the Children's Bureau, Elaine Bosestedt, to say a few welcoming words. Elaine?
Hi, Ken, and good afternoon, everyone, and welcome to today's webinar. I hope you're as excited as I am to hear from Cambria. I will say that I think that everybody on the phone, it's great to have such a turnout, and whether you work in child welfare, substance abuse treatment, or the courts, I think it's the recognition that it takes everyone working together to improve outcomes for families affected by substance use disorders. And the National Center is certainly committed to helping you improve the safety of children and families affected by substance abuse. And I think that if you look at the work of the Children's Bureau at SAMHSA and our increased interest in looking at the use of implementation of evidence-based practices, that this webinar is certainly in line with really honoring that commitment. And so really welcome you to please submit questions through the chat function that's available on the webinar, and look forward to hearing from our presenter and hearing what questions you have. So thanks, Ken.
Thanks, Elaine. Appreciate that. So once again, welcome everybody. I want to welcome the Regional Partnership grantees and all of the sites that we work with under the National Center. I understand that there are some of our in-depth technical assistance sites, as well as some of the work that we do, Children and Family Futures does with family drug court sites and providing technical assistance there. And for those of you that are not affiliated with any of those programs, we certainly welcome you. I'm glad that you can join us today. In addition to the overview of the selection and implementation of evidence-based practices, Cambria will be focusing on these specific implementation domains that you see on this slide: external compatibility, match of skill set, training support, and financial considerations, relative advantage. And presenting those implementation domains and their challenges and experience with some real-life situations that many of you are experiencing and have experienced with the implementation of evidence-based practices. Cambria will also discuss important considerations in fidelity monitoring and sustaining evidence-based practices. We're real excited to have the California Evidence-Based Clearinghouse and Cambria join us for this webinar and presenting today. And I'd like to take a moment here to introduce you to Cambria Walsh, today's presenter. Cambria has experience in working with counties and agencies on the implementation of safe care and trauma-focused cognitive behavioral therapy. In addition, she has an extensive history working with families involved with the child welfare system. She is currently the project manager of the California Evidence-Based Clearinghouse for Child Welfare, overseeing the day-to-day operations of the project. Many of you are already familiar with the California Evidence-Based Clearinghouse, and we certainly have utilized their work in the implementation of evidence-based practices, and certainly as a reference to understanding the degree of evidence that the California Clearinghouse attributes to each of the evidence-based practices that are cataloged in the Clearinghouse. Cambria has a background in mental health and has worked as a therapist for children who are impacted by abuse and their families. She developed a training program that focused on educating child welfare workers about domestic violence and its impact on families, and provided direct support to the workers during home visits. And so with that, I'd like to turn the webinar over to Cambria Walsh from the California Evidence-Based Clearinghouse. Cambria?
Thank you very much for that introduction, Ken. Yeah, I'm very pleased to have been asked and have the opportunity to come and present for you on the work that we're doing on the California Evidence-Based Clearinghouse, and specifically on the work on implementation. And we wanted to start off today with looking at a quick poll question here about how many of you have actually accessed information or resources from the California Evidence-Based Clearinghouse for Child Welfare website. So just to get kind of a sense of who has actually been on the website, that will help me in kind of gearing how I frame the conversation that we're going to have today.
We're going to give you about just 30 seconds to answer the question, please. Thank you. Just a couple more seconds. Thank you. The poll's now closed, and you should be seeing the results up on the screen.
Excellent. Thank you. That is very helpful. And this is a pretty common distribution when I do trainings in terms of who has been on the website or has a lot of familiarity with it versus those who have not. So I'm, pleased to see that some of you have been to it, and it looks like, more than half of you have not. So I'm going to start off just real briefly with a very brief background on what the CEBC website is to place this in context for those of you who haven't been to the website. So we started the program registry side of the website back in 2004, and it now has over 300 programs listed in 42 topic areas. And I think it's important, to understand that that's where our work started. Our work really started in kind of identifying what evidence-based practices were out there. We rate all of the practices on a 5-point scale, with 1 being the most well-supported practices, and down the scale from there, using randomized controlled trials as kind of our gold standard. And if you go onto the website, you can see in very clear terms exactly what our rating scale consists of. I'm not going to take the time to go through point by point on that, but just to know that we do rate these programs, and that's where we really started off. The programs that are on the CEBC website are programs that are delivered to children and families that are in the child welfare system. They are not necessarily programs that the child welfare system itself delivers. So for instance, we have looked at substance abuse treatment programs. Those are not programs that you typically would expect a child welfare worker to be the one delivering, but they are programs that the child welfare worker would refer to the families that they're working with to, in order for the families to receive those services. So that's an important distinction to understand. I also want to highlight the fact that we're called the California Evidence-Based Clearinghouse because we are based in the state of California and funded by the state of California. But the reality is the information that is provided on the website is quite relevant across the country, and we actually get quite a few international visitors as well. And it's very relevant outside of the country as well. And really, we've been a leader in the nation in terms of looking at evidence-based practice in the field of child welfare. And so people sometimes shy away because they see the California and think, oh, this isn't going to be relevant to me, but the reality is it's quite relevant. The programs, some of them are not even offered in California, though we do try to make sure that we include ones that are commonly used here in California. Some of the very strongly researched programs are not as in common use here, and we look at those as well. So the website started off with the program registry, as I said, and then over the last couple of years, we've really been kind of looking at, so now we have all of these programs on the registry. How do people make decisions about what is going to be appropriate for them to select and implement within their system? And so in order to do that, we created the CEDC Selection and Implementation Programs section of the website, and that's the slide that you're seeing here right now. And the goal behind this was really to provide some guidance and resources about implementation of evidence-based practice. And we arranged it in 3 subsections. There's a section on tools and resources, there's a section on the guide to selecting and implementing evidence-based practices, and then there's implementation examples. So within these 3 sections, you'll find some information on research that's been published on implementation. You'll find information on different articles about specific implementations of practices, so implementations of practices like trauma-focused cognitive behavioral therapy, multi-dimensional foster care, so a lot of different practices themselves and some information that we have specifically on implementing those practices. The big kind of centerpiece of this section, and what I'm going to refer to a lot throughout the presentation today, is our guide to selecting and implementing evidence-based practices. And this guide was developed after we did some work within California, a couple of counties here in California, and also in the state of Florida, on implementation. And we worked with these 3 counties on kind of how to look at their systems and make some decisions about what new practices might need to be put into place and how they would go about selecting those practices. So based on that kind of hands-on work that we've been doing, we developed this particular guide. You can download it off of our website. It's a free resource. And a lot of what I'm going to refer to in the next hour or so with you is directly out of that particular guide. And so it's a great resource to be able to go into and look at. The guide is based on a model that we use called the EPIS model, which is Phases of Implementation model. And EPIS stands for Exploration, Preparation, Implementation, and Sustainment. It's a 4-part model that we utilize to talk with counties and systems about how to make decisions and then actually move through the phases to the point where you've implemented a practice and you're sustaining that practice. And this was developed out of research and work that was done through the Child and Adolescent Services Research Center, which is another department here. The California Evidence-Based Clearinghouse is based out of Rady Children's Hospital in San Diego, and the Child and Adolescent Services Research Center is also based out of Rady Children's Hospital. So we worked in partnership with the researchers in that department as we looked at how are we going to roll out the information on implementation. Within the selection and implementation guide, each of these areas, exploration, preparation, implementation, and sustainment, are discussed in detail, as well as key steps for each of those phases are identified, and then tools and resources are provided as well within the document. The model is a linear model, but it also looks at course corrections that need to happen along the way, and so you may have to go back to an earlier stage if you've already kind of moved through the selection process and you're in the active implementation stage of this, the implementation stage here, and you're having difficulty within that stage in actually implementing the practice that you've selected, then you may need to go back and look at some of the selection decisions that you made and go back into the exploration stage or go back into the preparation stage and make some changes and then move back into actually implementing the practice. And the sustainment, as you can see from the arrows here, really happens all along the way. If you're not thinking about sustainability from the very beginning, in the very beginning of the exploration stage, then you've already kind of missed the boat with being able to successfully sustain the practice. It's something that's really, really important to consider as you're making decisions about which practice that you're going to bring into your agency. So it actually falls into each of these stages to be thinking about sustainability. And the reality is that most of the work that we do within the CEBC actually is focused on the E and the P of the EPIS model. Once you're really solidly in that implementation stage and you've selected a specific practice, there's some general guidelines that we're able to give, and we do that within our guide. But most of the work is then becomes program specific, and you have to really look at what are the needs for that particular program. So for instance, if you've gone through the selection process and you've made the decision that you're going to implement parent-child interaction therapy, then you need to really look at what are the implementation needs for parent-child interaction therapy, which may be very different than if you had chosen a different practice to implement. So at that point, part of what we do in terms of those guidelines is really move you toward talking with the program developers themselves. And I'll talk a little bit more about that later on in this presentation. So in the exploration phase, which as I mentioned is one of the areas where the CEBC is really able to provide quite a bit of guidance, we went through and we talked about the key steps that would happen in this phase. And so this is right out of the selection and implementation guide. So the first step is to form an implementation team. You want to know who it is that's going to be working on this implementation, and this may include, definitely you will want it to include leadership. It may also include stakeholders. It may include the providers themselves that are going to be implementing the practice. So you need to think about who is going to be really critical in your particular implementation that needs to be thinking about which particular practice are you going to implement in this case. And that implementation team may change throughout the stages. We reference it in each of the phases of the EPIS model, but what it consists of and who needs to be part of that does change as you move through that model. And we do provide information in the guide about kind of thinking about the implementation team through the different phases. Then the first step that this implementation team really needs to do is they need to identify the problem. And this is a area, as we did the technical assistance, that we realized was really a struggle for the counties and the systems that we were working with to think through. And if they failed in this step, if they were not really identifying the problem and correctly identifying the problem, then that set them up for a lot of challenges throughout this entire process and made it much more likely for them to have, or unlikely for them to have success in implementing the program and sustaining the program. And what I mean when I'm talking about this is it's really not enough to say, for instance, there's a large population of kids that are reentering the child welfare system, and then jump from that to, well, we need a better reunification program. And this is an example that came out of one of the counties that we worked with. And what we did with this particular county is we went back with them and we said, let's look a little bit more about and understand a little bit more about this particular problem. So you're having, a large reentry rate that's happening. So kids are graduating and being reunified with families, and then a new referral is coming in and they're reentering the child welfare system again. And in order to do this, we need to look at the data. We need to have a better understanding of what's going on within this particular system. So to look at the data, we want to look at things like what are the ages of the kids that are reentering the system? What are some of the demographics? Are they all in one specific area of the county? Are there other things that are similar between these particular children that are coming back in? What were the initial referrals that brought these children into the system in the first place? And is there commonality between those initial referrals? And then what services did these children and families get while they were active within the system? And what were the outcomes of their participation in those particular services? And then looking at what is the reason for reentry? Why did these children actually come back into the system? So in this particular example, as we worked with a county around this issue, and as I said, their initial, when they came to us and said was, well, we know what the problem is. We have these really large reentry rates, so we think we need to pick a reunification program. We've gone on your website. We've looked at the reunification programs. We're kind of leaning toward this one. We just wanted some help from you to think this through. And we stepped back with them and we said, we really need to look at, what's going on with that particular problem. And so we worked with them on kind of narrowing down again, who was the target population that they were working with, and then worked with them on conducting a needs assessment and really looking more into the data that they had on that. And what they discovered as they looked at this was that the majority of children that were re-entering the system had been initially referred to the system because of substance abuse issues and were being re-referred to the system because of relapse that was going on around the substance abuse issues, the parental substance abuse issues in the family, and that the services that the families had been through for substance abuse, they had done well in those services, but then the aftercare that was being provided once they had completed their substance abuse programs was not strong enough to really keep them from relapsing. And so the county then went from, well, we need a standard reunification program to maybe we really need to look at what are the aftercare services that we have in place for substance abuse and how we work with families around that particular issue. So again, you really want to be able to kind of narrow down and know exactly what your problem is, because if that county had gone forward and they had picked a reunification program and gone to our website and said, okay, we want one that has a lot of research, and picked home builders, for instance, that probably would not have solved the problem that they were actually having, which was the high relapse rate that was going on for families, because home builders is not designed to address substance abuse and relapse rates specifically. So it might have had some minimal effect, but it wouldn't have really gotten to the core of what the issue was that was going on in this particular agency or system. So once you get to the point where you've really identified then what is the problem, then the important piece is to look at what are some of the potential solutions. And some of the pitfalls that we often see people fall into with this is they immediately go to, well, we need to pick the program that has the most evidence. And so we're going to pick a program on the CEBC website that's rated 1. And as the project manager of the CEBC, I will tell you that is not the right pathway to take. That what you really want to do is look at the program fit for your particular population. The program can have a lot of research on it, but if it's not for the target population or for the particular issue that you really need to address, then it's not going to have the outcomes that you want to see it have, and it's not likely going to work on solving the problem that's going on within your community. So you really want to look beyond just the research. That's one aspect of what you want to look at, but there's a lot of other pieces that you need to look at as well. And we'll go through that and kind of that selection process in just a moment. And then you also want to make sure that you're keeping track of all of this work that you're doing. So you want to create a written summary that will really kind of summarize the work that's being done, so that 6 months from now when you go back to kind of look at how did we get to the point where we picked this program, or you have a change in leadership and they want to know more information about, well, how did you come to pick this particular program, you've got all of that very well documented and you're able to provide that information and refer back to that. Because we all know that we get very busy and we're all multitasking and working on multiple things, and it's easy to kind of lose the memory of kind of what process did you go through and what was the data that you looked at and what was that information. So this doesn't need to be a lengthy document, but we certainly suggest that you do document that particular information. So before I move in to talking about kind of the implementation in real life and how that selection process works, I want to just pause for a moment here to see if there are any questions.
Cambria, we don't have any questions at this time. If you would like to send in any questions using the question and answer log, we still will have time at the end of Cambria's presentation for her to address those.
Excellent. So let me continue on here. We're going to talk a little bit about implementation in real life. And this particular area we're going to go through specifically starting with our selection process that we go through. So within the guide that we put together, the Selecting and Implementing Evidence-Based Practices Guide that you can find on the CEBC website, one of the tools that's located within that guide that's specific to the exploration section is our selection guide for EBPs and child welfare. And this is just a brief synopsis, which I won't read from you, about what the selection guide actually does. But what I will tell you is we developed this based on work that was done in the UK by a researcher by the name of Tricia Greenhall, where she looked at not evidence-based practices specifically, but she looked at how you sustain innovations in health service delivery and organization, and she did a systematic literature review to look at how this was being done, and based on that she came up with key elements. And so we utilized the key elements that she came up with in her research because they all seemed to really make sense to the work that we were doing, and had research showing that they were important, even though they weren't specific, as I said, to evidence-based practice. They were, services as a whole. And we then created this selection guide, which goes through several of the domains, and I'll talk about a few of those in a moment. And within that selection guide, we also provide information about where you can find information on the CEBC to help you as you walk through those different domains, and also some real-life examples of what types of things come up in each of those areas. So the domains that we looked at within the selection guide as a whole is we looked at ease of use, so how usable is this particular practice, and how easy is it going to be to learn, how easy is it going to be to implement, those types of issues. We looked at external compatibility, which we'll talk about more in depth in just a moment. Financial considerations and relative advantage, which we'll also talk about more in depth. We looked at internal compatibility, which is how compatible is this particular practice with your existing workforce and within your existing agency. So for instance, if you're picking a practice that you're going to bring in and there's going to be existing staff that you're going to utilize, then you want to make sure that it's a good fit for the background of that particular staff, the education that that particular staff has, and sometimes in some cases even their theoretical orientation. So for instance, if you are bringing in a new practice within a mental health agency, and that mental health agency has historically provided psychoanalytic psychotherapy, and you make the decision that now you're going to bring in trauma-focused cognitive behavioral therapy, you need to think about, is that going to work? Are your practitioners going to be open and willing to use that particular practice? How well is it going to fit within the philosophy of your institution? The knowledge requirements refers to the training that's necessary, both the formal training on the practice itself, but also, again, what the minimum provider qualifications might be for this particular practice. The massive skill set we're going to talk about more in depth in just a moment. Observability of benefits, which refers to how quickly and how easily can you see that there are benefits happening. We're a lot more likely to have staff that's going to buy into a practice if they can really see the benefits that are happening for their clients, and we're also going to be a lot more to have likely to have clients engage in the particular practice if they can see changes fairly quickly and easily in terms of how the practice is impacting them. Reinvention and adaptability, so again, looking at your specific organizational setting, and are there things that you're going to need to make adaptations to, and we'll talk more about adaptation in just a little bit as well. But there are, some practices are a lot more adaptable than others, so you want to keep that in mind as you're looking at the selection process. The risk refers to how big of a change is this going to be for your organization, how much of a financial risk might there be, what might potentially go wrong if the practice doesn't work. Training and support refers to what training and support are available, and again, we'll go into that one in a little bit more depth in just a moment. And then the trialability is referring to, is this a type of program that you could pilot, so that maybe you would start it in just one office or with just a few staff and try it out and then be able to roll it out further from there, or is it a practice that you're going to need to jump into with 2 feet and decide that you're completely going to embrace it and make large changes within an entire organization or entire set of agencies at once. So again, these are all important factors. We've chosen the 4 to go into depth based on feedback that we got from all of you about some of the areas that have been most challenging around implementation. But certainly if folks have questions about the other areas when we get to the next stopping point for questions, please do feel free to ask questions about those as well. So the first area that we're going to look at more in depth is external compatibility, and this is an example of some real-world challenge that happen around external compatibility. So is the intervention aligned with the target population? Intensive parent-child clinical interventions with children in out-of-home care, this is an area where this can sometimes be very difficult when the children are not in the home, but you're trying to have a practice where the parent and child need to be in the practice together, and looking at what is the feasibility of that within your particular target population. Difficulty engaging foster parents to transport children in out-of-home care to come to the actual sessions, and interventions that are ranging 12 to 20 weekly sessions and require longer-term commitment from all involved than what the target population may be able to do in terms of how much of the service is able to be funded, how much time that there is within the case plan for those services to take place. So all things that you need to consider. And this example really addresses concerns with the EBP selection and the ability to implement better engagement strategies. So there's a twofold piece to this. You know, there's things within these challenges that, you know, if you were able to engage, you know, would you be able to overcome some of these, and are there some things that you need to think about in terms of your engagement, or did you pick a practice that isn't really going to be a very good fit with your particular target population, and it's, you know, no matter how much you try to engage, it's not going to work within the constraints that you're operating under. These are types of issues that you really want to think through early on in this process so that you don't have to make course corrections later on. If you do run into these problems, then it's important that your team, that your implementation team that you have formed as you've worked on this, spend some time looking at what corrections you can make. Once you're already in the midst of implementation and you've selected a program, then you need to really talk with the program developer about any suggestions that they may have around engagement issues or around ways that they may have accommodated a program to meet the needs of a specific practice setting. And if changes cannot be made to make the program work, then there are options to look. Are there options to look at another program? So, you know, in some cases you may have that ability to say, okay, we started to implement this, it isn't working, we need to go back to the drawing board and start the selection process again. In other cases that may not be an option. You have to look at, okay, given, you know, what our constraints are, what are we able to do at this point with this particular practice? So let's look at some of the key questions that you want to be asking to make the determination about fit with the target population during the selection practice so that you don't wind up in situations with some of these challenges that are going on. So the first key question that's on here is, how compatible is the practice with the beliefs and values of the local community and clients? So you certainly want to make sure that it's going to be a practice that's going to actually work for these clients. You know, this could be things like the transportation issue. If you've got, you know, a very geographically diverse, very spread out community that you're working within, and it's not going to be realistic for people to transport the children to come to the practice, then picking a clinic-based practice may not be the best choice for your particular situation, and you may want to be looking at in-home practices. On the other hand, if you've got a community where you know, there's a lot of belief or shame about the types of practice, so mental health practice, for instance, and people are not going to be open to having a therapist coming into their home because their neighbors might see that the therapist is there and, you know what's going on and have reactions to that, then you need to think about, is an in-home, you know, the best. So you need to kind of look at what are some of the belief systems, the value systems, the needs of the particular target population that you're working with. You also want to look at, is the practice compatible with the referral sources that are currently in place in the community, and will they feel comfortable referring clients to it? So one of the big issues that we have seen in our work with counties is they may actually have the right practices available within their communities, but nobody's utilizing those practices. The referrals are not coming in, and so therefore the practice is not being rolled out in the way that it was meant to be rolled out. And oftentimes, because not enough time was spent in these early stages of exploration, and a lot of the work that's done in the preparation stage, once you've selected the practice, is really looking at how do you set up a referral system that's going to be effective. And if you don't take the time to get those pieces in place, and you rush into rolling out the practice, then you can be very challenged with getting enough clients. And then what we find is you've trained your staff, they're all ready to go, and they don't have enough clients, so they're not practicing what they learned in their training. And then time goes by, and they start losing what they've learned in the training, and they're not feeling at all comfortable with doing the practice because they're not having the opportunity to actually carry out what they've learned. So it's really important that the referral process is set up well, that clients are being referred to the practice, that they're appropriate clients that are being referred, and that the people who are referring the clients really have a good understanding. So we often talk about the importance of training those who are going to be making the referrals so that they really understand what the practices they're referring to. So, a great example of that is we rolled out a program locally here in San Diego with trauma-focused cognitive behavioral therapy that was a contracted program with our county child welfare. And we started it, we opened the doors, and we weren't really getting appropriate referrals. And we realized that we had made a huge misstep because we hadn't gone in and actually done any training or provided any handouts or information about TFCBT to the child welfare workers who were making the referrals. And so they simply weren't understanding what types of clients should be referred for service. And since the contract had changed from another type of service that was being provided for this specific group of clients, the child welfare workers were very confused about the differences. It had been a group program previously, now it was an individual program. The duration of the program had changed from what had been offered previously, and none of that had been communicated to them. And so we had to do a lot of work to kind of play catch up and go back out and really make sure that they understood what types of referrals should come in to that particular program, and what types of referrals weren't going to be appropriate for that particular program, which sometimes is as important as what is going to be appropriate. Now, obviously, with any mental health program, you're going to want to have a good assessment that's being done, once they make it into the mental health. But you also want, the child welfare workers to have some sense of how to screen the referrals, to know, for instance, this child had experienced a specific trauma and therefore was going to be appropriate to have some sort of trauma treatment that had some sort of indication that they were having some symptoms related to the trauma that they witnessed, those types of things. You also want to dig into whether the practice is going to be a good fit for the target population. So additional questions that you might want to ask are things like, what is the duration and intensity of the practice? And is this a fit with the population? If it's a 52-week program and the target population that's being referred is only being monitored for 15 weeks from whatever the referral source is that's referring them to you, and then they're no longer going to be mandated into the treatment, then are they going to continue to come? Or if the payment that you're going to be able to get for the particular treatment is only going to last for a certain number of weeks, then you are going to have to figure out how would the remaining weeks then be paid for. So there's a lot of fit pieces that you really want to be thinking about early on with this. You also want to think about what type of practice setting will be most successful. So again, as I talked about with transportation issues, do you want to look at an in-home program because that's more likely to meet the needs? So again, you have to take into consideration all of those factors as you're thinking about what type of program is going to be most appropriate. And then you want to compare some of the different programs that are out there to see, what's going to be the best fit. Does it serve the age, child that you're really most focused on serving? Does it have an in-home, the ability to do it in-home or not? So asking all of those sort of questions as you're looking at the different practices. So one of the questions that came up, and these are questions from the registration, was about engagement and motivation and keeping people involved in the evidence-based practice. And so what are some of the strategies for keeping people involved, and then how do you follow up with clients who may have stopped participating? And again, this is very practice specific, so you certainly want to talk with the program developer for any advice that they may have on that specific evidence-based practice. You want to look at why the clients have stopped participating. Is it because of logistics? Is it because of transportation issues and those types of things? Is it something about the specific practice that's going on that just isn't a good fit and isn't working for the group of clients that you're trying to engage in it? Or is it something specific that's going on with the individual clients that's has very little to do with the actual practice and just has more to do with some of the other issues that may be going on for that particular family or child? At this point, I want to just check in with Ken because I know we had some conversations about engagement and see if there's anything that you'd like to add around the engagement piece.
Thanks, Cambria. I think you summarized some of the challenges associated with retention and engagement. I think a number of the sites that we work with have experienced that to various degrees with the implementation of evidence-based practices. Certainly the external compatibility, all the things that might be going on with the family and the requirements can influence that. We often ask sites that we work with to really look at the data points as to where people may be dropping out, not following through. Is it early on in the practice, or is it late, or is it after the practice has been implemented for a while? So there are a number of challenges there. Another question that comes up from the sites that we work with is kind of where in a treatment process would certain evidence-based practice interventions where are they best implemented? So if it's an intensive, like therapeutic intervention, like parent-child interaction therapy, is that done best after a person has some time in treatment and some recovery time, and that they're better able to participate? Other evidence-based practices can often be a catalyst. Some of the parenting programs can often be a catalyst and don't require recovery time or a significant amount of time in treatment. It can be a catalyst for a parent to take a look at their substance use and how it may be impacting their parenting. So it does depend on the intervention, and it does depend on some of the external compatibility factors as well as how it fits into the overall array of services, both on the child welfare side and on the substance abuse treatment side, mental health treatments that a parent, a family may be receiving.
Thank you, Ken, for adding your piece there. That's really helpful. You know, what Ken and I had talked about earlier was, you know, he has a lot more knowledge, specific knowledge of the grantees who are listening to this, and so I wanted to have him chime in a couple places here to talk about how this is most relevant to the work that all of you are doing. So he will do that a couple times throughout our time this morning, and that way you get a break from listening to my lovely voice and get to hear somebody else's voice for a couple of minutes. So we did also want to talk about kind of a success in terms of external compatibility. And so this is a success for the community that have been struggling with finding services to engage parents in treatment and their substance abuse issues. And after holding a stakeholders meeting and discussing possible treatment programs, it is agreed that adding motivational interviewing into the existing substance abuse programs would help to increase the parents' engagement in substance abuse services. And I think, you know, involving the stakeholders piece of this is really critical. It really helps you better understand the external compatibility issues and get feedback that will increase the likelihood of success. And of course, in terms of engagement issues, you know, motivational interviewing is one of the most researched and, you know, from all indications from that research, most effective way to really work with clients around engaging them in services. It's been used in substance abuse, and that's where most of the research is, but it's also been used in child welfare and in other areas as well. So that is an engagement strategy. It's another evidence-based practice that you could consider when you're looking at, you know, kind of what's going on with the engagement that's happening with families. So the next area that we're going to move into is around financial considerations and relative advantage. And the first slide here again is a real-world challenge. Staff training costs for the evidence-based practice were much higher than expected due to staff turnover, and more staff was needed to address the logistics for the implementation of the evidence-based practice than had first been thought. So, you know, tight budgets are a reality in this day and age, and it's really critical, again, in this exploration stage when you're kind of looking at the various different practices to thoroughly vet the financial costs for the initial training, and also keep training for new staff due to turnover, because the reality is we know that there's turnover that happens within our agencies, and different models handle how you can get additional training in different ways. Some have train the trainer models, others you have to go through a very specific training, and it only takes place in certain times or with certain people, and costs a certain amount of money. So you want to look at, you know, if you think that, you know, there's a strong possibility that there's going to be turnover, and I would say in most cases you want to be prepared for that, then you want to look at what are the opportunities within the different programs for that training of new staff that are coming in. You also want to be making sure that you're keeping in mind how long the training lasts and how staff productive time will be impacted, as well as the actual cost for the training. So, you know, sometimes the immediate thought is to just look at, well, what's the price tag for the training itself without thinking about that the training is a week long, and if you're transitioning from, let's say, one type of home visiting program to another, and so you have existing staff that you're that's making this transition, and they're not going to be able to see clients for that week, and there's revenue that comes in from clients being seen, then how are you going to make up for the fact that you're losing money over that time? So you need to look into that in terms of your financial costs as well. So these are all issues, again, that you want to really be thinking about before you get into the midst of them. If you do wind up in these situations, again, you have to look at what are the possibilities, for making course corrections midstream. What are your possibilities from your funder, to be able to make those changes, and what possibilities are there within the practice itself that you might be able to make changes to that would help you address some of these. So again, looking at the specific practice, looking at your general ability to make changes in terms of which practice that you're utilizing and how that might impact finances. And if you make that course correction, again, what's the financial cost going to be if you've already trained several staff, and then you make the decision that you're going to change to a different practice, and those staff are now going to need to be retrained. So you want to take all of that into consideration as you make decisions about how to do course corrections. So some of the key questions that you want to ask in this initial exploration stage to avoid getting into challenges such as the one I just described is you want to look at what financial resources to fund the practice exist, both in the short and long term, the costs for initial and ongoing training and consultation, costs for other resources that you might have associated with the program. So if you're going to implement parent-child interaction therapy, for instance, there's specific equipment, there's a one-way mirror, there's different requirements, specific rooms that might need to be built, that type of thing. So what's that cost going to be? And then does the practice have a clear advantage for the organization in terms of efficiency or cost efficiency compared to what's currently being done? So you want to take all of that into consideration. You don't want to get into those situations where you're partway through the training and then you determine the cost to implement the EBP is beyond the cost that was originally budgeted in the grant proposal or in however you're proposing to fund that particular practice. You may not have access to additional funds at that time, and then, as I said, you're going to have to make some decisions about how to course correct. You have to look at costs to fund the service delivery as well as the costs for the training, consultation, and for staff productive time. So when we worked on a grant where we did home visiting services, for instance, we had to really look at how are we actually going to fund the services themselves. They were not something that was going to be easily billable through an existing like mental health program or that type of thing. And so we had to look at how are we going to have the services actually paid for beyond just the training of the staff. And finding the information on the cost benefit is very complex, so that's not something that we have tackled on the CEBC website specifically. We don't really have the resources to do the in-depth work, although we're asked about it quite a bit. And part of the complexity with it comes is the cost to implement a program like nurse-family partnership, for instance. In San Diego is very different than the cost of nurse-family partnership in New York City, and that's very different than the cost for implementing it within Fairbanks, Alaska. I mean, it's just, each area has, the cost of the staff. Nursing staff may cost very different in different parts of the country or even within different parts of the same state. The costs for space to be able to utilize, to do different practices may be different. So there are a lot of really complex factors that you have to take into consideration. We do provide information on the training that's required, so how long the training is when we have access to that information, minimum qualifications for staff, and the resources that are necessary to conduct the practice so that you can start to get an idea of what some of the costs for that particular program may be. There's some wonderful work that's being done on cost-benefit analysis through the Washington State Institute for Public Policy, WISIP. And so if you Google WISIP, which is WSIPP, you can find out more information about the work that they're doing and kind of what they've looked at cost benefit. And it gives you kind of the sense of how complex that particular area is to really look at. But there are things, as I said, that you can do where you can start looking at your own budgets and what the cost itself would be. When you start looking into the benefit piece, that's where it starts to get quite complicated to be able to compare to the services that are currently going on within your community to the practice that you might want to bring in. But they have some great information and resources on the WSIP website about that. In terms of a real-world example with success, after implementing trauma-focused cognitive behavioral therapy, which is a short-term therapeutic intervention, the organization was able to better serve its clients by decreasing the time clients were waiting to receive services. So there's certainly, the financial piece, which we talked quite heavily about, but there's also the relative advantage piece, which is, we want things to work efficiently so that we don't have long wait lists, so that clients are able to be seen and get into services. So if you're providing a model that's, a 12 to 15 week treatment versus a model that's a, 40 to 50 week treatment, or services as usual, which tend to drag on because there isn't as much clarity in what you're actually providing, that's going to be a benefit to the client because they're actually going to be able to get into the services much quicker. So the next area that we are going to look at is match of skill set, and this is our third real-world example, or third area that we're looking at. And the challenges that often come about with match of skill set is challenges finding qualified staff. So one example of this might be the evidence-based practice requires a mental health practitioner that's eligible for licensure in the state. In order to fill that particular position, you have to have somebody who applies and is interested in the position and that's actually able to be licensed. And sometimes when that's the case, positions may be open for a long period of time because you don't have applicants who meet that minimum provider qualification. So you really want to look at, the danger of not finding the right fit, as in this case, but there's also the cost of the workers. And so there's some really key questions that you need to consider in this area so that you can avoid this particular situation. So let me go through those. Oh, I skipped. Yeah, so here's the key questions. So you want to look at what education level or pre-existing skill set is required for staff. So it's really important, when you're looking at each of the evidence-based practices that you're considering, that this is an area that you compare them on and look at what is the type of staff that I'm going to need for this program. How does this fit with the existing workforce in the community? Or in some cases, even how does this fit with the existing workforce in the agency? If it's an agency that's going after an RFP, for instance, that's going to move them from working on one type of home visiting program to another type of home visiting program, do you already employ the type of staff that meet the minimum qualifications, or is it going to require you to restructure your staff? And how easy is that going to be in your particular community, and how disruptive to client services is that going to be if you have to make huge changes in your staffing in order to move forward with the program that you're choosing? And our staff with the appropriate skill set and education level, even available to recruit. So do they exist in the community, or is that going to be something that's going to be challenging? In a lot of communities, there's shortages of certain professionals, whether it's nurses or mental health practitioners, and those types of things. So you want to be thinking about all of these pieces so that you don't get into the situation where you're 6 months down the road and you can't even hire the right staff to be able to deliver the practice because they just don't seem to exist within your community. This is especially an issue in the smaller communities. We see this in our smaller counties here in California, where they simply might not have a lot of social workers or therapists or nurses that are available within the community. And if that's the case, it's going to make it very difficult for them to be able to recruit and provide that particular service. And so they may need to look at other alternative services that are going to be a better fit for their workforce that they're actually going to be able to implement. And here's a real-world example of a success. The agency's existing workforce is composed primarily of social workers, and the agency is interested in implementing a home visiting program. Despite the high level of research evidence for the nurse-family partnership program, a decision is made to not select nurse-family partnerships since a nursing degree is the minimum qualification for providers, and this is not a good match of skill set. And we see this happening quite a bit with this particular program. Nurse-family partnership requires the use of nurses in order to implement it. And here in the state of California, for instance, we have a large shortage of nurses. It's very difficult to hire nurses, and they also are very costly. And so you have to keep, all of those factors in mind as you're making a decision. So yes, this program, does have a lot of evidence to show that it's successful, but the evidence that shows that it's successful is all done with nurses as the ones delivering this. So if you make that type of change to this particular practice, then you really are no longer doing the practice with Fidelity. And you're better off looking at different practices that may be available that also may have high levels of research evidence but use a different type of provider in order to make it a better fit with your particular community and what's available. So this was a very good choice on this agency's part because they realized two things. One is that they would have to change all of their workforce in order to move to this particular program since they only had social workers that were working for them. And you have to think about what's that going to do to your agency if you have complete turnover in terms of who your workforce is. Not just the impact on obviously those workers themselves, but the impact on your referral sources. If you make that drastic of a change, what happens to your standing within the community and the relationships that you formed with other providers in the community that are referring to you if you suddenly have drastically changed your workforce. So there's a lot of pieces that you want to take into consideration with this particular issue. Ken, is there anything that you would like to add in terms of any of these examples that we've talked about around match of skill set and recruiting appropriate providers?
Sure, Cambria. I think one of the challenges that we face, you've hit on, it is in a rural area, and we've seen situations where some of our grantees would have a person trained and they would become very marketable and then move on. Also in our field, we employ a lot of persons with life experience in recovery, and so if those folks might have various degrees of education, they bring their own personal experience in, so matching an evidence-based practice with their skill set, their comfort level, their training, etc. Is also, I think, an important consideration, particularly in the context of implementing these practices in substance abuse treatment program. Also want to go back to your other point about generating referrals and having engagement, and is it the right practice, and the cost efficiency of it as well, and that's scaling the practice, and it may be a great practice, but that is very labor intensive and may only be able to serve a small number of clients, of families, and that may be workable in certain contexts in a large program where it's a specialized service and you've got a large client pool, but in other situations it may not be efficient at all, that you put a great investment in a practice but may be only able to serve a small number of families, and is that going to have the impact let's say on the outcomes that you're trying to achieve in your program. So kind of looking at that scaling is real important, as well as the pool of potential participants. One of the regional partnership grantees has done a really nice job in the area that they're implementing services for children 0 to 3 to look at, well, how many children are there, age 0 to 3, and how many of those children are in out-of-home care, and how many of those children are impacted by substance abuse, to look at the potential pool of participants, and is there enough to sustain the scaling of the practice that they're being implemented, and did a really nice job in doing that kind of analysis. And all that was front-end work, again, to align the intervention with the target population with these considerations. Thanks.
Thank you. Yeah, and I think, the last statement that you made there really kind of hits on things. Is it's a lot of front-end work. The more work that you do through this exploration and really, thinking through these issues before you're in the midst of it, the smoother your implementation process is going to be overall. So the next area that we're going to move into talking about, we've already kind of touched on, so we'll go through this one fairly quickly, but addressing training support. So real-world example, how much training do we need? Grantees propose an evidence-based practice that has a long and unexpected wait for training. Evidence-based practice requires ongoing training and support for up to 1 year. The grantee is unclear about the available training support in the case of staff turnover. So these are all issues that you want to be very clear about up front as you're thinking through which practice that you want to be bringing in, and not once you're about to implement the practice. And there's some key questions that you really want to ask to get at these particular issues. And it's important to realize that there are practices where there are really long waiting lists. That's not unrealistic to find that out. So you really want to be clear about all of that information before you launch into making the decision that that's the practice that you're going to go with. And you want to look at how long those time frames are going to be for training and consultation. Is that going to be realistic, both from a budgetary standpoint and also just from a time standpoint for your particular situation? And again, the issue that we touched on earlier about how do you train when there's staff turnover? What's the model for retraining? So key questions that you want to ask in this area: how much training and consultation is required before the program can be delivered? How will the current staff be trained? So what is going to be the impact on caseloads, on time off for training, all of those types of issues? Is the training for the practice currently available, or if there's a wait list, is it going to be available in the time frame necessary for it to be implemented? Does ongoing consultation get transferred from the trainers to the agency level to continue support once the initial training is finished, or will there be a need to continue to contract for ongoing training? And this differs quite a bit between different practices. There are some where they do some initial consultation and then they train people within the agency, typically supervisors, to be there to continue to provide consultation. And then there's other areas where they only will have the program staff from the program itself be able to provide consultation. And so you want to look at what is the situation and what is your ability to fit into either of those types of models. And what is the process for new staff to get trained when turnover occurs? How often are other trainings happening? Is there ability for staff to travel somewhere to go get trained, or do you need to bring the trainers out, and what are the costs for each of those types of situations? So again, you want to carefully look at that for each of the practices that you're considering. So a real-world example of success: a small agency in a rural area reviews the training costs and availability and uses this information to select a practice where training is provided on-site. It's determined that this is much more efficient than sending their workers to training off-site. This on-site trainer will also provide phone consultation as a follow-up to the training, which will allow the staff to get further support. So again, especially when you're a rural area or a small county, you really have to think through the feasibility of being able to do certain things around the practice, and training is one of those. And so the more forethought you're able to give to that and think through, what are the options? Are there other nearby areas that you might partner with? If you bring a trainer out, that you can split the cost, or is it going to be more financially make more sense to go send somebody to a training? Again, you want to look at what are all of those costs and what's going to work for in your particular system or community in order to have the training happen. I'm going to pause here again to see if anyone has any questions. You can use the question and answer log to enter those in, and we'll give you just a moment. It's a lot to digest in a very short amount of time.
Cambria, there is kind of a follow-up question.
Okay.
Ken spoke a bit about at what point in recovery it's appropriate to refer a family to a particular EBP. And I was just wondering if you could share where that information might be available if an organization is looking for that type of practice.
So the best advice that I can give on that is to contact the program developer themselves and find out from them what their advice and feedback is on that, because it's really going to differ program by program. So some programs obviously, are meant for people in different, who've been through substance abuse issues and who are in different points within their recovery, and other programs maybe an add-on, that aren't going to be as successful until somebody maybe at certain points. And so again, you have to look at each program individually, but that is a really important question to ask and to consider, especially working, in the area that you all are working in, is how is that going to fit in, and at what point is that practice going to be, so for your specific situation, that would definitely be a question that you would want to be asking the developers. You're kind of exploring possible programs to bring in.
Great, and we do have one more question, and it follows up again with the area of strategies for keeping people involved in EBPs. Do we have any, or can we offer any suggestions about how to keep people involved in evidence-based practices?
So I'll throw out a couple of thoughts, and then Ken, if you want to jump in and say anything additional, I certainly welcome you to do that. I think one of the key strategies for keeping people engaged in anything, whether it's an evidence-based practice or not an evidence-based practice, is you want to make sure that they really have an understanding of what it is that's going to happen within the practice. So as much as you can provide information, during the initial meetings with them about how long, what the duration is of the practice, what the requirements are going to be for them in order to participate, what types of benefits, they're going to see out of this, and how soon they might start seeing some of those benefits. So again, the more that they have an understanding of what you're providing, the better engagement you are likely to have with them. And a lot of cases, when people start off doing an evidence-based practice, they're still trying to understand it themselves, and they don't really explain to their client, what it is that they're really going to be doing. And so the client then is left with, how long is this going to go on for, and what am I really going to expect to get out of this, and what should I expect sessions to be like. So I think the more kind of education that you can provide about that, is important. And then really looking with the client around, what might be some of the barriers for them being able to come, and are there things that you can work with them, to strategize how to overcome. So if there are logistical issues around the timing of when, sessions or the, group is being held, that might be an issue for them, or transportation issues, or any of those types of things, you want to address those sooner rather than later, so that you don't start in and then realize that this isn't really going to be a good fit for them, because they've got barriers to being able to actually make it to where you're doing the treatment. Anything that you would add, Ken?
That's a great point, Camber. Yeah, the implementation of these practices, as we all know, are not done in a silo or in a vacuum. And so the point that you make about educating participants, family members, parents, children about the services, how do these services fit into the larger context of all of the things that we may be asking a parent to do? So in the situation that we're all working in, families are coming across systems, right? They're coming into the child welfare system, and then being referred for services to other community agencies. Well, oftentimes we find that parents aren't really educated and told about how everything fits together, who does what, and what you can expect over that life cycle, if you will, of engagement. And doing that up front, and sometimes doing it in writing with clarification, and having all of the partner agencies that are involved with that family understand their respective roles, if you will, of the agencies and of the services that are being delivered, and being real transparent about that is really important. And then also coming back and revisiting that with parents, particularly who are actively using substances, that in early periods of abstinence, their ability to retain a lot of that information is going to be impaired early on. So coming back and revisiting some of those clarifications is also important. So we have a tendency to kind of front load a lot of information in the first couple of sessions or engagements, and then we make the assumption that families, that parents in particular, persons with substance use disorders, have incorporated and integrated that information and just ready to go out and act on it. But that's not often the case, and so coming back to that, kind of checking in with them is real important as well. Earlier in the presentation, you mentioned about your experience in San Diego with having establishing an evidence-based practice, and the referrals weren't there. And the importance of engaging those referring agencies and folks that we work with on the phone on this webinar have heard me refer to that those partners are not just referral services, but they're partners. And to the extent that we're engaging, you're engaging those partners in the development and in this selection process, as well as the implementation process, I think has an important bearing and relationship to engagement, to generating referrals, and then everyone kind of being on the same page as a family experiences those services, and then how to engage and interact with those families when there are challenges around retention, so that all the systems are kind of moving in the same direction to the extent that's feasible in working toward trying to retain and reinforce family participation over a period of time.
Definitely. Thank you.
Those are all our questions at this time. Thanks.
Okay. So we will move into our next section, which is on supporting sustainability and also talking about Fidelity, which are two very important issues. One of the tools that we have in our exploration section of the Selecting and Implementing Evidence-Based Practices guide that we've created is around the importance of working with program developers. And this, what you're seeing on your screen right now, is an excerpt from this. And the next two slides that I'm going to go through kind of break this down a little bit more, but we wanted you to see kind of what this looks like in terms of how Fidelity will be ensured in the document itself. So, you know, one of the pieces that we talk about with Fidelity is it's critical to achieving the desired outcomes, but you have to understand what it means, what constitutes Fidelity for this program before you implement it. So it's really important to talk with the program developers around this particular issue. You know, how do they know that the program is being delivered with Fidelity? What does that look like? Do they have instruments in place? And again, this is something that really differs quite a bit from program to program. Some program developers have spent a lot of time working around Fidelity and have Fidelity checklists and have, you know, different tools that you can utilize for that particular program, and others have very little in terms of support for that. So that's another thing that you want to consider as you're looking at different practices, is how much implementation support exists for the practice, and how much do you feel that you're going to need in your particular situation. You know, so you want to weigh, you know, those types of issues. You certainly want to talk with the program developer to find out more about that. And oops, skip forward here. Fidelity monitoring. You know, in order for you to be able to develop any of your own Fidelity tools, if they don't have something that's in existence, you know, you need to make sure that they can specify what are the core components that need to be part of the model, what their experience may have been in implementing with diverse populations. So what accommodations or adaptations have they done in order to ensure client participation and make sure that it's relevant for certain clients. Some program developers have spent a lot more time thinking through the issues of adaptation and accommodation than others, and will have a lot of information about this, and others, this is not an area that they have spent much time working on and will not have as much information from you. So you definitely want to get a sense of, you know, what's already out there. You know, clarifying the mode of service delivery. So if the program's delivered in a group, is there a way that it can be delivered individually or adapted to be delivered in a family setting? So you want to, again, look at, you know, what information is already out there and available on this particular program. You know, clarifying caseload standards. So trauma-focused CBT is a great example, not exactly of caseload, but of, you know, adaptations to being made that impact caseload, which is that for most therapists, they see clients, they bill in a, you know, what we call a 50-minute hour, right, a clinical hour. And the way that trauma-focused CBT was designed was to be delivered in a 90-minute session. So that is not compatible with the way that most therapists bill, but the program developers of trauma-focused CBT have worked with many community agencies on how to adapt the material so that it can be done within the 50-minute clinical hour. That may draw out the number of sessions that you see with a particular client because you're seeing them for less amount of time each week, but there are ways to make modifications, and the developers will certainly work with you around that. So that's a nice example of an accommodation that sometimes can be made. And then asking for any specification regarding fidelity criteria, including the review of any tools that are used to measure fidelity. So again, some program developers will have that information to share. Others may not have that information. So that you want to make sure that you've got that understanding as you're going into making a decision about which program is going to be the best fit. Then there was a question that came in during registration around fidelity about how you continue to monitor fidelity through different stages of implementation. We have support for this right now, but what about long term? And I think this is, again, somewhat dependent on the individual evidence-based practice, but I also would say it's very important that you build this in as part of supervision, as part of day-to-day practice to help sustain it, so that it's not something that's an add-on that's going to disappear when your funding disappears, that you need to look at how do you implement this within the existing structure of your organization so that it is able to stay. And you want to continue, and there's a lot of advice that we give in the guide about how you kind of go back and look at how is your process of monitoring fidelity working. And it's not a one-time, you say this is how we're going to monitor fidelity, and then you stop talking about it. Like, you need to continue to revisit it and look at, is what we're doing working? Is it, do we feel like we're really maintaining the fidelity? Do we need to have a different way of doing fidelity checks? As I said, some agencies do it through supervision, and that works really well, but other agencies, supervision is handled in very different ways, and it may not be as successful to have it being done in an individual or a group supervision setting. So you have to look at what makes sense within your individual agency. Anything else, Ken, that you would like to add on the fidelity monitoring piece?
I think the point that you made about institutionalizing or incorporating it into existing processes. So if you're a provider, substance abuse or mental health provider agency, you have quality improvement programs and quality assurance, and to the extent that it can be incorporated. If you're a child welfare agency, most agencies undergo quality service reviews, and so to the extent that it's incorporated into your practice, and as you said, Cambria, not an add-on, the propensity for maintaining it, for sustaining that fidelity is increased significantly by doing it that way. And of course, always having the management and leadership support, kind of going back to the selection process for the specific implementation of evidence-based practices. For incorporating it and putting that on the table early on the selection process is important as well.
Excellent. Yes. I definitely agree. I think we're very much on the same page with that. So beyond fidelity, the other piece, with sustainability that we really want to think about, is some planning for sustainability that happens. And as I said, this needs to start happening in the very early stages as you're picking the practice. And you're making these decisions about which practice that you're going to select. You already want to be looking at how are you going to sustain that particular practice. So you want to make sure that you're engaging, in a candid discussion with the program developer about proprietary issues. Practices vary differently. Some of them have very strong implementation arms, and they're owned, and you can only, get training by going through very specific avenues. There's other ones that are a lot less formalized, and so again, looking at what's going to be your particular need, but having a really good understanding of that, and what does ongoing training look like. And as I said, some of them may have train-the-trainer options or other strategies to help sustain them in the organization. So you want to ask the program developer about, what are your sustainability techniques that you've utilized. I certainly think asking program developers if you can talk to another agency that has implemented this particular practice, and so that you can ask them some of the questions that you have about sustainability or fidelity, is a great place to start. You want to make sure you're really clear with the program developer about what the costs are, what the criteria is in order to implement some of these things like a train-the-trainer model. And talking about how future staff can get training, if there's availability of booster training, or if there's support beyond the initial implementation, what does that look like? Another important area for sustainability is funding of the services themselves. So oftentimes what we see happen is the services are funded by a time-limited source like a grant, and then when that grant goes away, the services go away because there's no plan about how they're going to be funded beyond the lifetime of that particular funding source. So you want to, really be doing work up front around, okay, this is how we're going to get this started, and this is how we're going to be able to provide these services initially, but what are other funding sources that we can look at and other ways that we can look at funding these so that they do remain sustainable beyond the time, or what are other grant or foundation sources that we can look into and start applying for early on so that we have a plan for sustainability. So you want to be looking at all of those issues, as you've identified which practice that you're going to be utilizing. And you want to keep in mind the funding as one of the things that you're looking at in the exploration stage. If there's a choice between two practices and one of them has a very clear way that it could be funded using certain existing funds within your system and the other does not, then that's one of the criteria that you want to look at in terms of what's going to be a good fit. Certainly not the only criteria, but it is one that you want to take into consideration. And I think that's kind of the crux of the issue with all of this is there's a lot of different pieces that come into play in terms of thinking about selection, and that selection process, in one place may look very different than in another place, and that's as it should be. It's a very individual process to look at what are the needs of your particular system, your particular agency, your particular target population, what funding exists within your community to be able to do these things, and really looking at those individual needs in order to make the best determination of what to pick to utilize within your community. One of the trends that we saw happening a few years ago and continues to happen is that when funders put out funding, RFPs, they're putting them out saying, it's for this particular practice, and they're not taking into consideration any of these individual issues that might be going on within the community. And, while we applaud the efforts to look at the importance of evidence-based practices and using an evidence-based practice, as we've talked about on the call today, there's a very thoughtful process that needs to happen with that. And if you determine that practice in advance without thinking through the needs of that specific community, then you may have already set up that community for not being able to implement successfully and not having a very sustainable practice. So you really want, to be able to look at what's going to be the best fit within any individual place, and that's going to lead to better sustainability.
Camber, this is Ken again. There are also some opportunities, I think, to think beyond the boundaries of a particular agency, that looking at it regionally might be opportunities for accessing training. So, for instance, motivational interviewing is now being trained in both child welfare and has been trained in behavioral health for a number of years. There are opportunities to request technical assistance, like under the Substance Abuse Block Grant, request technical assistance from SAMHSA. And that could be technical assistance for training. Oftentimes that training is not going to be available to a single agency, but would be made available to a region of multiple agencies. So partnering with other agencies in a particular region, saying, gee, we want to train a higher number of staff, let's say, in motivational interviewing or trauma-informed agencies, for instance, and trauma training, both in terms of trauma-informed agencies and trauma-specific interventions. So another example of practices that are being implemented in various settings, not just in mental health, substance abuse, but in child welfare, domestic violence. And so looking for opportunities to potentially request training and technical assistance on a regional basis might provide access where it wouldn't be provided just to a single agency.
Mm-hmm. Definitely. It's an excellent point. And those also may be good opportunities for any retraining that needs to happen of staff, as you have turnover that happens, to be able to access some of the regional trainings that are going on. So again, that can be very important. I know the next slide is a question slide, but I'm going to skip ahead just for a quick moment before we go back to the questions, but you can all be thinking about your questions while you're doing that. I just wanted to show you, this is the website, the CEBC website, which you can find at www.cebc.cw.org. So that middle part that's in there before you get to all the long, drawn-out part of this web address to get to this PDF. But this particular page that you're seeing here is the implementation guide itself, and that I mentioned that a lot of this information came out of that you can download, and it is full of a lot of tools and resources and things to help you think through some of these critical issues that we have touched upon today. So I just wanted to make sure before we run out of time today to highlight this particular resource, because it is where I drew a lot of the material from. And we continue to add to it and add information. And if you have questions specific to your particular program or things that you think would be helpful for us to expand into, we are certainly open to that. It's, the reason that we have it as a downloadable printable and not as something that we're just handing out to people in a print version is because it's kind of a work in progress that we think will continue to grow, and so we didn't want to limit it by having an edition that we sent out to everybody and then 6 months later say, oh, and by the way, now we've added this and this. So this way you can see the latest versions, and we actually have already done an update of this particular version since we released it in November. It's now got a new version on here. So back to our question and discussion slide here. Any questions that have come in, or any additional questions you can answer into or put into the log? Just a couple minutes before our time is out today.
Cambria, we do have one question, and this is actually kind of a composition of several questions that came in through the registration process. And it sounds like many of our attendees are interested in support as they move through the selection process for an EVP, and they've identified very specific target populations. So I was just wondering if we might talk about some of the other resources in addition to the CEBC that are available for folks selecting EVPs. And just so you know, some of the other target populations identified have been juvenile justice populations, parenting, and trauma. So any information or resources you can provide.
So certainly around some of the substance use and trauma, you know, NREP has information on programs, but these are also areas that we actually do highlight on the CEBC. So on the CEBC, we have looked at substance abuse treatment for both adults and for adolescents. So we have programs that are listed on our website, and we actually used Nancy Young as our topic expert, who I know many of you are familiar with because she's associated with this particular project. So she helped us in identifying those. We do have a parent training topic area, so we have a lot of information about parent training programs, and we also have a trauma treatment program, both trauma treatments for adults as well as trauma treatment for children that we've highlighted on our website. So we have a lot of that information that's available. But as I mentioned, NREP is another clearinghouse that does have information on additional programs. And the Blueprints Project, which is run by the Annie E. Casey Foundation now, Blueprints for Violence, has some information around some of these topics as well. Now, each clearinghouse rates things and kind of does things differently, so you want to look very closely at what information is associated with that particular clearinghouse. But yeah, all of those areas are ones that we actually have looked at, you know, mostly in reference to child welfare populations, but a lot of the programs are relevant, you know, to juvenile justice and other mental health and other fields as well.
Thank you for that, Cambria. I think we're coming to the end of our time, so I'd just like to walk through the final slides and thank you all for participating today. As Cambria pointed out, this is available. This is the link to the PDF document that she was referring to in the presentation. Additional information about the California Evidence-Based Clearinghouse for Child Welfare is also included here, including a way to sign up for their email alerts and also the info email where you can contact them directly. And finally, we'd just like to thank you on behalf of Children and Family Futures and the National Center for Substance Abuse and Child Welfare for joining us today. Should you have any additional questions, this is my email, and this is again Mariana Corona. Please feel free to follow up via a direct email. For those of you who are putting in questions now, I would just like to let you know that we will be getting all of these questions to our presenter, and we will be putting together a document that will summarize the questions and her responses, as well as some of the responses during the discussion today. So again, if you have any questions, please feel free to email me directly. We will again send out an email with a link to the materials and the recording once that is posted on the Children and Family Futures website. Thank you. Ken, any final comments?
want to thank Cambria for a really informative and practical presentation, and appreciate your willingness to be available for any follow-up that any of the participants in today's webinar may put forward. Also, for the regional partnership grantees, we're going to be spending some time together in July and providing opportunities for networking for you to reach out to each other to share some of your experiences, successes, and challenges with implementing some of the evidence-based practices, some of the things that we talked about today around engagement and retention, around sustainability. And so we look forward to giving you those opportunities and facilitating that interaction as well. Thanks, Mariana.
Thank you.
Thank you, everybody. Have a good afternoon.